All right, this is day one of the NCLEX review series, what the NCLEX actually tests and what it doesn't. So before we start, go ahead, follow, bookmark, and share this with your study buddy because you're going to want to come back to this one. All right, now, if you're sitting there trying to memorize every single lab value like your license depends on it, stop. All right, the NCLEX is not a spelling bee for electrolytes. Nobody's asking you to recite potassium like it's a monologue in a nursing school talent show. Okay, here's the truth. The NCLEX, especially the next gen version, is not testing how much you memorize, it's testing how well you think. All right. Can you recognize a patient who's about to crash? Can you make a safe call when everything feels urgent? Can you focus on what actually matters and let the noise go? All right. So let's do a scenario. All right. Patient A has a mild incisional pain and a temp of 100.3. Patient B just had a hip surgery, is confused, breathing 28 times a minute, and her O2 is 88%. All right. That's fat embolism syndrome sneaking in like, guess who's here to ruin your shift? All right. Or this. All right. Patient A is on oxygen, stable at 91%. But patient B just got IV morphine and now they're hard to wake up and breathing 6 times a minute. Well, who do you see first? The one trying to stop breathing every single time. Now, those might seem obvious. All right. But those are the types of questions that you'll likely be seeing. All right. These are the judgment calls that NCLEX lives for. They want to see if you know the difference between uncomfortable and potentially dead in 3 minutes. So here's the reality. You don't need to memorize every drug side effect ever made. You do need to know which ones are dangerous. You don't need to know and recite every lab value. You do need to recognize the ones that mean this patient is about to code. So if you're spending hours on flashcards about pancreatitis versus peritonitis, but can't tell who to see first in a 4-patient scenario, then let's fix your study plan. All right, let's start studying smarter today. Number 1, ask, would this help me keep my patient alive or safe? If not, skip it. Practice real next-gen questions, case studies, drag and drops, highlight the clue stuff. All right, 3, focus on red flags, like when you see things about confusion, low O2, airway issues, abnormal vitals. If it feels sketchy, it is sketchy. All right, think about your brain is the bouncer at a nightclub. All right, but only let those dangerous symptoms to the front of the line. Okay? Here are your key takeaways. The NCLEX isn't about memorizing everything. It's about recognizing what matters most and acting fast. Next gen equals clinical judgment. Think like a safe, aware new nurse, not a walking flashcard deck. All right? So drop a comment. What's something maybe you feel you've been overstudying that probably isn't worth the stress? All right. And don't forget to follow because tomorrow we're doing a breakdown on who do you see first. And spoiler alert, it's not always the loud one. Sometimes it's the quiet patient in the corner just casually losing their airway. Until then,